This is Rogers TV. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello, everyone. Welcome to Local Update. I'm Carrie Fenn. The COVID-19 pandemic has pushed our healthcare system to unbelievable levels. Healthcare workers continue to put their lives and well-being on the line as the number of infected residents climbs. No one knows that better than Lori Lopez, registered nurse and Durham resident. Joining me via Skype is Lori. Welcome to the show. What unit do you work in, Lori?
I work in day surgery.
Do you work in Durham region?
No, in Toronto.
In Toronto? At what point in March did you realize that things were changing?
Well, definitely when they declared an emergency, and like when that on I guess March 13th, March 14th, when things started to get really more serious. I think I knew previously when they decided that there would be no more elective surgeries, that they were taking things far more seriously than prior. As
a nurse, you always work with sick people. Since the COVID-19 has been highly contagious, does that concern you or cause you to take any additional precaution?
Yes, it does actually concern me. On a personal level, I guess I have a blood clotting disorder called factor V Leiden that makes me predisposed to having blood clots like pulmonary embolus and DVTs and stuff like that. So when I'm at work, I tend to try to keep myself more hydrated, try to move around lots so I'm not just sitting, and trying to really think about where my hands are doing. So I'm always like touching my hair and my face, my glasses, and washing my hands a lot. So I've taken to, wearing headbands to keep my hands out of my hair, and taking the time to, before I do anything, to really think about whether or not I cleaned my hands. And of course, the social distancing, not being close to anybody. When we're standing and talking to each other, it's normal to be almost side by side when you're talking, but to maintain some distance.
So you would have more of a concern than the average nurse to try to protect yourself.
I think so. And I think all nurses, depending on where they are in their stage of life, because our nurses could be anywhere from like 23 to 67 years of age. So everybody has their own. If they're a grandparent, if you may have a husband who has cancer, you may be a young mom who's going home wanting to hold your baby. And like, I know women are going home and not wanting to hug their kids because they feel like their kids may be at risk hugging them.
Yes.
So there is that aspect that we go home and worry about bringing it home to our loved ones for whatever reason.
Is there a limit on the number of masks you're allowed to use for each shift?
Well, when we go to work, they were handed bags with masks in them. But now, just this week, the Ontario Nurses Association has advised us that we now have use to N95. If we do a risk assessment in our area, we feel that we need to use one, then it should be there so that we can use an N95 appropriately going into a room with a patient who may have COVID. So that's been a huge relief, seeing that that this is now available.
Yes.
It's like a boulder being released off our chest, like that we can actually use the N95 if needed going into a room.
Are you given an N95? We've been hearing a lot about PPE, N95, all these different things that the public generally don't hear. What are you provided with to protect yourself?
So, and when we walk into the hospital, we're giving masks, like they're a level 3 mask that we put on. They want us to put it on right away. And then specific to where you work, like if you work in the ICU or the emerge or on a medical floor, you should have like a shield, you should have hair covers. In some areas, we're given the uniforms, like scrubs that we can change into, so that at the end of our shift, we can change out, leave the dirty scrubs, and then wear our clothes home.
Yeah.
And not everywhere seems to have that, though, from what I'm understanding. But I'm lucky at my hospital, we have the scrubs. And we have gowns, we have the masks, gloves, and then the shields. And then depending on what we need, there's different kinds of masks.
Do you know what type of PPE are provided in the suspected rooms for COVID-19? Would it be the same as a regular, like a regular daily nurse PPE right now, or is it a different type of equipment that's provided for anybody that's suspected of having it?
It should be. Nurses are like stewards to try to save the PPE so that we're not misusing them and running out. So we should really be assessing whether or not the full N95, the full PPE is warranted. And we're trying to, like I know when I was speaking to my colleagues in the ICU yesterday, they're trying to minimize how many times they might go into a room with a patient with COVID so that they can kind of do everything at once to save the PPE. Because we are conscious of the fact that it's costly, we're running out, there may not be enough. So as far as a number, I haven't heard a number of like how many N95s that were being given, or like face shields. I know the face shields are an issue as well. Like we have to be careful that we don't waste a lot of the PPE. But nobody has actually said to me like, oh, I only have 2 N95s for the day. I think that it should really depend on the situation and like not misusing it or going into a room every 3-4 minutes and then completely having new PPE every time.
Yes.
I don't know if that makes sense to you or not.
Is it the same personal protective equipment that's used in the positive cases? Do you find that, or are you aware of whether or not the equipment is different that's used to protect the frontline workers?
If somebody's positive for COVID, or if you're just in the hospital and you're healthy, if I was going to take care of you as somebody who has no symptoms, I really don't need to wear the full PPE. It would be more of somebody, if you were sitting, like you're in the hospital and you came in because you had the COVID symptoms, and you had like cough, fever, you weren't feeling well, then we would want to protect ourselves and wear the PPE.
How long? I know a lot of people might be concerned about this because we're all trying to maintain our lives through such a difficult time. How long can the virus stay in the air for? Well,
post-intubation, it's from the studies that I've read and from what I'm being told, it could last in the air to up to 3 hours, that it lives on like a droplet, like in the air, like aerolized. So what a lot of hospitals seem to be doing is that they are intubating people in an OR setting and then bringing them to the critical, like the ICU or the critical care, to minimize that 3-hour window after, because that's usually when nurses are very busy at the bedside, and the ICU is after somebody's been intubated, because you're doing so much like ECGs, you're doing blood work continuously. They're constantly maybe needing medications, increase, decrease, to have the proper heart rate, heartbeat, pain level, sedation. So if they're doing it in the operating room, then that room would be closed down for a bit to, I guess, wait till that the droplets are like cleared up, and then they would be cleaned a very specific way by the housekeeping.
Do you think your hospital have enough PPE, or what are they telling you about the supplies that they have?
I haven't heard a specific day. Like I know some hospitals are saying like they have a day or two left of PPE. I haven't heard that yet about where I work.
Do you know personally of anyone that you work with that actually contracted COVID-19?
A touch wood? No, not yet.
Not yet. That's really good to hear. How are your nurses actually dealing with things emotionally?
Well, I think people are I think people cope with it differently. I mean, everybody's there for each other, of course. Like, we want to work with our coworkers. We want our coworkers to be safe. We don't want to leave our coworkers in a situation where it's unsafe and not just show up for work. So we're there to support each other. How people are coping, I think people are probably going home exhausted, probably not sleeping. Some people might, cry more, have anxious behaviors, that kind of thing. I think people are afraid when they go home to touch their families. And coping at work, it just seems like a lot of people at work, we're just trying to prop each other up and support each other and how we feel.
But that affects your immune system, doesn't it?
Being upset?
Yeah.
Yes, probably.
Probably.
So for me, trying to take some extra vitamin C, vitamin D, I don't know if that's true or not, but trying to eat a little bit more healthier than usual, like lots of fruits and vegetables, and trying to get enough sleep so I'm not going to work exhausted and then very emotional. And just trying to be calm when other people are upset, which can be easier said than done, depending on how you feel at the time.
Is it hard to be away from your family at this time? How does that impact you guys?
Yes, I think so. I think it is. I think when you go to work and you're nervous about bringing the bug home or the virus home, it's it's hard.
Are there a lot of patients in the hospital with COVID-19, and how much do you think?
Well, when I was there yesterday, it seemed to be quite, like, the ICUs were filling up and there's quite a few on the floors, but they're not really telling us the exact number, I don't think.
Mm-hmm.
So I'm not really sure how many.
Yeah, I think we're all trying to figure out what's going on, or walking around thinking, do you have it? Do you have it? But I hope we're all taking extra caution that's needed and listening to the individuals that are able to provide us with accurate information so that we can get through it, at least try to protect ourselves and get through this the best way we can. And we appreciate individual like yourself or on the front line. It's not an easy thing for us as well as you guys to go through, right? So
yeah, I'm a lot more observant and more when I go to a store.
Yes.
Like, I think it's great when they have the hand wash when you walk in. I'm very cognizant of what I touch. If I do touch something, then I know, oh gosh, I should just buy it. So
yeah, it's good. It's a good thing to have, and I'm so glad to see the stores actually putting out hand sanitizer. We're going to take a quick break. When we return, I will continue my conversation with Lori Lopez.
Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Oh, here we go.
I'm knocking at the door. I'm
definitely going to be the last one standing.
This is mine.
Bring it on. I'm ready to go.
Go, 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 go.
Not ready for this to be over.
This is the most perfect dish.
You represent the best culinary talent in the country.
May the best chef win.
Top Chef Canada. New season Monday, April 13th on Food Network.
Welcome back. I'm Carrie Fenn. Frontline workers play a key role in providing care for us during a pandemic like COVID-19. Lori Lopez, registered nurse, is with me via Skype. How has the average age change with regards to patients with COVID-19 over the past few months? Why do you think that the ages are getting younger and younger? Is that the case, or do you think that most people who are diagnosed are in the older stage, the majority?
Well, it sounds like a lot of our nursing homes have a lot of infectious patients there. So there's that one segment of the population that is, I find, very sad. Looking at Bob Cajun and all those elderly patients that live there that have passed away and that are sick. But then at the same time, we do hear like a lot of younger people who are like here in Whitby. There was a young guy at McDonald's. There's been a person at Sobeys, and then a retail worker passed away from COVID that worked at Loblaws.
Yes.
So it is a concern, like these people that are essential services working and being exposed. And I would think that's probably partially why younger people are getting infected, is because of either their work, or maybe they're not socially distancing the way we would be optimal. Mm-hmm. I have heard that children have passed away. I'm not sure how they would have been infected, but I think the social distancing is huge. And
is it under 12 cases or above 12?
I've heard under 12, a child has passed away, and I've also read there was somebody in Ontario, I think that was 18, that passed away from it. Oh. So I try not to look at the numbers too much, but I know even my child said to me that she had 97.7% risk of getting COVID, and I said to her, "Where are you getting this from?" She's like, she's hearing it from either YouTube or TikTok or something. And I thought, geez, kid, no, anybody can get it. Yeah. You can't think that. And if you get it, you could pass it on to one of us. So I think the kids are misinformed that they are automatically safe.
Yes.
And so I'm not sure where that's coming from.
My son said the same thing to me, that he won't get it. He's under 12. So I don't know where they get it from. How understaffed is your unit? Are you working extra shifts on a regular basis? And how difficult has it been to balance work with home life, under such a stressful circumstances?
So generally speaking, before all this happened, Ontario has the worst RN to population amongst Canada. There were studies done a few years ago through the RNAO and the different High and stuff, where they said that for every 100,000 population, we only have something like 669 nurses. Mm-hmm. So we already are before this, we are often short, during a flu season. There's just never seems to be enough RNs. Mm-hmm. So, and the problem with the whole COVID thing that's going to really stress RNs is we're the only ones who are critically trained to take care of COVID patients. Mm-hmm. So we're the ones taking care of the COVID. And then as our RNs, if we start to be infected, my question is, who will take care of us?
Yes. How are you protecting your family? And are you guys living together or living separately? Because you're in the hospital so often. How do you deal with that?
So far, what I've been doing is when I come home, first of all, I change at work. I wear home new clothes from work. I don't bring home my dirty clothes from work. When I get home, I go through my garage, and my husband has waiting for me clothes in the laundry room. So the clothes that I do wear home from the hospital, I've put right into the washer. I have hand sanitizer there, so I wash my hands. And then everything goes into the washer, and then I go right upstairs and have a shower. And then, so right now I haven't been socially distancing myself from my family, because I haven't been really in the ICU or emerge or anywhere taking care of actual COVID patients. So I'm comfortable being around my family. But in the event going forward, when I'm being deployed, if I do start taking care of COVID patients, I will be, I'm going to stay in my bedroom.
You also worked in the hospital during the SARS outbreak back in 2003. How does that compare to COVID-19 outbreak going on right now?
I think the biggest thing with COVID is social media. Being able to see on Instagram, Twitter, Facebook, being able to follow what was going on in China back in January, and then seeing what happened in Iran, Italy, Spain, and now New York and Seattle, like following like how they go from one patient to like thousands. That's a huge difference from SARS, like being able to kind of watch it happen throughout the world. And then seeing the different, just being able to talk to people right across Canada on social media, like what are you doing? What are we doing? What works for you? What's not working for you? That's a huge, I think it's a beneficial thing, but I also think it can be a little bit more, adds to some anxiety because you're always on social media. Whereas before and during SARS, it was kind of like, where did you get your information from? It was basically maybe the news or newspaper. And then you were hoping that your coworkers, your bosses and stuff were keeping you updated. But during SARS, during SARS, it seemed to be more healthcare workers were getting sick and dying. So it was way more, it was terrifying. I didn't work in a hospital where we had any of our staff were sick. I worked at Markham Stouffville. So all the patients, basically, we would have them on our unit. And sometimes we didn't even know that we had a SARS patient on our unit. We would find out after the fact. So it was nerve-wracking in that sense. And during SARS, we like double gloved, we double gowned, we double masked. Because as it evolved, we found out things that we did early on maybe was contaminating us in the nursing station. So things like constantly evolved throughout SARS. And I just remember, the double mask and the double gown and being hot. So
that would be a drastic change between what happened then and now. Do you actually know when there's like a COVID-19 patient? Comparing the two between then, you dealt with SARS and then you're dealing with COVID-19. Are there any other similarities or differences between the two that you notice?
I think the big thing that was kind of odd to me, like not odd, but when you hear that people are going home and to isolate versus coming into hospital to be nursed, right? That was kind of a relief for me, because then you think, okay, if they're well enough to be at home, then because initially most of the people were well enough that they could go home.
Yes.
That kind of is a relief to me as far as like an infectious kind of thing versus people coming in automatically very, very sick. I don't know if that makes sense, but that's a big difference. And the other difference was, I guess during SARS, like we would just double glove and gown for a whole shift, and not necessarily because the person had it, but it was more of we just did it. But whereas now we're more conscientious, we don't just throw the equipment on for having the equipment on, like we may not be around anybody. So that to me is a big difference. And I think maybe, I think that's the biggest difference for me.
What were the lessons learned then that have helped now?
From SARS?
Yes.
The biggest thing from SARS was when, through the SARS Commission, when they had a commission and there was the gentleman, Justice Archie Campbell, who he had said, when you have a situation where the science is evolving, like this scientist says this scientist says that, nobody's agreeing on the science. It doesn't matter who's right, it doesn't matter who's wrong, it doesn't matter if you're like if you're conservative, if you're liberal, whatever, or what group you're in. The primary thing to worry about is the workers and the workers should always be paramount. They should always have the full work safety. And so they call that the precautionary principle. And so for me, I find like this time coming around, knowing that the precautionary principle and knowing that this Justice Archie Campbell has come up with that theory that no matter like yes, no, who's right, who's wrong, any worker should automatically be safe. Mm-hmm. That to me is what is huge compared to SARS. And so I think like it gives me some comfort to know that we have that the SARS Commission to go back to, yes, and as a reference point.
At first, we thought those who traveled were the most at risk. Now there's clear evidence of the transmission within community. What do you think is causing the spread, and how does it happen? Can people protect themselves against community spread?
I honestly think probably the only way to protect against community spread is by staying home, mm-hmm, and not having like the social parties, not having the social interactions like at parks and malls and stuff. I really think that people should just go to the stores when they absolutely need to, and get in and get out, and not touch everything and smell anything. You go with a list of what you need, get it, and then leave. I think that's the only way we'll see anything improve.
How does it make you feel when you see people not following physical distancing or doing their part when they're putting yourself in jeopardy and every day?
It's a lack of, I guess people just don't have the understanding of how many hospital beds we have in Ontario, how many ICU beds we have in Ontario, what it means that if they get it, mm-hmm, and if they end up needing a ICU bed and there may not be one for them. I don't think people realize that it could happen to them, that they could get sick. Mm-hmm. You know, we all have that thing that, oh no, it never happened to me, but it will happen. Like if we look at the numbers in the USA, Spain, Italy, I think it's to think that we can't get it because we're here in Canada. I don't think that, to me, like I'm not upset with people, I'm not angry. Mm-hmm. I just wish that people would be more aware and more educated to stay home.
And follow the right thing in order to protect,
follow the right rules, and wash their hands, and cough into your arm versus coughing into your hand. No touching your nose. If you have a runny nose, don't wipe with your hand and then not wash your hand. A lot of just the etiquette and
those are actually wonderful tips that can help the community. That's all the time we have for your local update. I'm Carrie and Fenn. Thank you to Lori for joining us, and thank you for watching. And don't forget to take a moment to thank our frontline workers for their help. And remember, together we're stronger.
Call the Rogers TV viewer response line, email us, or connect with us on